In this video, we will discuss some commonly seen diabetes-related complications. Diabetic foot ulceration is multifactorial with a combination of peripheral neuropathy, trauma, peripheral vascular disease, and difficulty with wound healing. Secondary infection leads to ulcers and abscess. Although gram-negative rods may be encountered, Staph aureus is the most common pathogen. Anaerobic organisms may occasionally be seen in patients with gangrene. Diabetic patients presenting to the emergency department deserve a foot inspection. Many patients with diabetic neuropathy are asymptomatic, with their index presentation being a painless foot ulcer. Diabetic patients are at increased risk for ischemia. Diabetics will commonly have atypical presentations of myocardial ischemia. Keep this on your differential for patients presenting with weakness, fatigue, or confusion. Gastroparesis is the result of autonomic neuropathy and is a common complaint in the emergency department. Gastroparesis will present with vomiting and bloating. Occasionally, patients will report abdominal pain. The differential diagnosis should include all of the usual suspects. Diabetic patients with a history of gastroparesis will often exhaust their home regimen prior to presenting to the ED. Treat with prokinetic agents such as metoclopramide and correct fluid and electrolyte imbalances. Have a low threshold for admission. Diabetic patients are more likely than non-diabetic patients to develop malignant otitis externa. Symptoms are usually unilateral and include a tender external auditory canal and purulent drainage. Contiguous spread can lead to mastoiditis, osteomyelitis of the skull, or meningitis. The threshold for imaging these patients with CT or MRI should be low and is required to identify the extent of anatomical spread. ENT consultation is mandatory. Fournier gangrene is a form of necrotizing fasciitis which usually involves the male genitalia and perineum. Despite its male predominance, females are occasionally diagnosed as well. Clinical evaluation reveals pain that is usually severe and out of proportion to the apparent erythema, swelling, and palpable tenderness. Treatment is aggressive resuscitation, IV antibiotics, and surgical intervention. In summary, diabetic patients commonly present to the emergency department for management of diabetic complications. Tailor the history and physical examination to identify precipitators, threats to life or limb, and resuscitative needs. Have a high index of suspicion for pathology, and remember that diabetic patients have an increased risk for morbidity and mortality compared to the general population. A consistent approach will help you avoid pitfalls in caring for this cohort of patients. For Team Health, this is Dr. Patrick Cody. Thanks for watching.